Garmagas, and thank you, Cathaoirleach, and welcome to Minister Colin Burke here from the Department of Health. Minister, we have seen €35 million coming into Portiuncula University Hospital. That is a 50-bed unit that's going to transform patient care. That was just opened recently by Taoiseach Simon Harris on the 11th of September. This has been crucial. I led the delegation that literally brought the clinical delegation up here to Leinster House to meet with the then Minister for Health, Simon Harris, at that time in 2019, to fight for this. It should have happened 10 years ago. And there's a lot of other investment into the hospital in Portiuncula that should have happened and needs to happen now. This development is so welcome, and from what I understand, it will ensure that we have more capacity within our hospital. It's an acute level 3 24/7 hospital, maternity hospital for the region, a training hospital with multiple medical academies, with the University of Limerick, with the University in Galway. And what we've seen now is that those two wards, those two 25-bed wards, Orchard and Garbally, have just opened. The Taoiseach, when he spoke on his visit to Ballinasloe, spoke about the investment. He spoke about how it was more than just a hospital, that it was a community in the town of Ballinasloe and surrounding areas. He spoke about the extension of day services, the oncology services, funding be delivered for the sterile support department, and now for the new ambulatory gynecology unit, which is due to open shortly. He acknowledged the conversion of the outpatient department, which was done after COVID, because before COVID and the pandemic, we had 13 single rooms in that hospital. 13 single rooms. Because of the work by the clinical team there, they converted the outpatient department to the Dunloe suite and doubled the availability of single rooms. We've seen the expansion of minor operations and plastic surgery, the new nurse-led infusion unit, the opening of the Willow Suite, which is the protected space for bereaved families in the maternity unit, and we've seen a brand new A&P advanced nurse practitioner take up her position in Portiuncula University Hospital. 2 years ago, I advocated strongly with Taoiseach Leo Varadkar to ensure that we would have additional treatment bays in our emergency department, which has seen zero investment and work over the last decade to 2 decades. Currently, this is at design stage, Minister, and I am very grateful for the work that has been done in the Department of Health to progress this. But I know that we see huge waiting lists, people on trolleys, and this happens, of course, coming into every winter, but we've seen huge episodes over the summer as well when there's spikes. Today we're going to hear about our budget. Today we're going to hear about allocations into each department, and I know that Fine Gael and government will deliver one of the largest budgets in health, Minister, and I know that you will welcome that as well. I want to see an update here, Minister, on the timeline for the construction stage and capital expenditure for the 9 treatment bays into the ED. I want to know what's happening with the multi-bed ward blocks, where we moved patients and will be moving patients out of those multi-bed ward blocks into the 50-bed. What will we do now? How will we renovate those multi-bed blocks that are currently in the middle of the hospital that could be used for so many other roles and positions as well? Staffing is always one of the key things that is brought up, Minister, when it comes to our hospitals. We see that the sort of challenges around recruitment are being lifted. We're seeing that there's more availability. However, there is more administrative sign-off and approvals in different stages around the recruitment process, which again makes a recruitment process that in a hospital healthcare network that is mammoth, even longer again. Our student nurses need clinical placements. We need to make sure that we have the people in place in our hospitals to provide those clinical placements so that we can bring in more students and student nurses, and particularly into our specialities. Minister, we know that maternity leave has been a big issue. I guess when I speak here about capital expenditure, I am bringing in something around staffing. Maternity leave, when it happens, is causing huge challenges around the replacement for maternity leave. Garmagat.
Minister Burke, you have 4 minutes.
Thank you, Cathaoirleach. Thank you, Senator Dolan, for raising this matter. I'm very much familiar with Portiuncula Hospital as a member of my own family. Worked there for 12 months a number of years ago. Unfortunately, at the time they were working there, it was they worked 136 hours one week, and they were on call for 76 hours the following week. Obviously, the whole junior doctor system has changed since then. I think that's very much welcome. Thank you for raising the issue in relation to capital expenditure for Portiuncula University Hospital here in Lishannet, and I welcome the opportunity to update the House on this important facility in our health service. The Government and the Minister for Health are committed to the ongoing development of regional hospitals such as Portunkla University Hospital, this government has allocated significant resources in order to meet the needs of patients using the hospital. Staffing at the hospital has grown by 228 since January 2020, from 843 to 1,092 in 2024. That represents an increase in staffing of 27%. And I'd also like to pay tribute to you, Senator Dolan, for the work you've done in getting a number of the projects through. Since 2022, this includes 37 more nurses and midwives, 13 more medical and dental staff, 10 more patient care staff, as well as 3 more health and social care professionals. In 2020, Portunkla had a budget of 83 million. In April 2024, the budget was 126 million, meaning its budget has grown by 43 million. That's a 51% increase in just 4 years. Under the acute bed expansion plan, 16 new beds are being delivered at Portunkla University Hospital over the course of the next 4 years, and 10 of the new beds opened in tandem with this 50-bed ward block in September 2024, which you referred to. These 10 beds will be enhanced by a further 6 new beds, which will be provided between 2024 and 2028. The HSE are currently developing extra capacity of 9 extra ED treatment bays in the emergency department, and funding of 6.9 million has been allocated to this project to date. The design team was appointed in early 2024 following a competitive tender process. They are developing a preliminary design and outline design scheme to meet the project brief. The target completion date for project is 2027, as this is a complex project. The 9 additional treatment bays will be included in the current building footprint and will allow the hospital to re-establish an acute medicine assessment unit. This development will stream patients from the ED and allow the Frelity team to operate more efficiently. Just last month, the Taoiseach visited Portunkla University Hospital to officially open the Orchard and Garbally wards. These new ward blocks comprise of 25 single rooms with en-suite facilities and will start accommodating patients in the coming weeks. The new ward blocks facilitate the transfer of 2 existing outdated wards from the main hospital building. The design and layout of the new wards will deliver a patient-centred approach, improve patient experience, particularly for those requiring end-of-life care. Single-room accommodation will also reduce patient exposure to possible infections while in hospital. By improving the patient's journey, these new wards will reduce length of stay and reduce the number of in-house patient transfers between wards. The old multi-bedded ward blocks will now be reconfigured to provide additional capacity, in addition to providing extra space for the acute medical assessment unit and oncology day ward. The HSE are responsible for staffing and recruitment, and the staffing of new capital developments is facilitated by the estimates process that occurs annually. The HSE have confirmed that staff and funding has been approved and recruitment is currently in progress. In addition to these projects, there has been a range of recent developments in the hospital, including the expansion of minor operations in plastic surgery in 2023, a new nurse-led infusion unit opened in March 2023, and the opening of the Willow Suite to provide a protected space for bereaved families in the maternity unit. These projects, along with the future planned work, speak to the high level of investment this government has put into University Hospital, into Portunkla University Hospital, and will continue to invest for the benefit of patients. And in conclusion, just to thank you, Senator, for the work that you have done in highlighting the issues and bringing them to a successful conclusion as well. To thank you for doing that.
Thank you very much, Minister Burke. Senator Dolan.
Thank you very much, Minister, and I very much appreciate your own personal connection with your wife, of course, Dr. the obstetrician, Dr. Mary McCaffrey here. You're very much aware of that hospital, Minister, that it dates back to the 1940s. This has been an incredible investment, and I just want to acknowledge just the numbers that you've mentioned here, where we're seeing up to 50% increase in budget. 126 million is absolutely incredible increase, but it just shows that it was so overdue. It was so overdue. And to have over 1,000 people working in our hospital, we have absolutely excellent healthcare staff that are really working to the highest standards, but again, working in facilities that date back to the 1940s. So this new 50-bed block has been an absolute wonder and will transform patient care for nearly 5 counties, nearly a catchment area of 400,000 people. But again, the ED, I see here the timeline is 2027. Minister, my ask to you is that there are people who are on trolleys. We have paediatrics that do not have enough space or capacity within our hospital. We had 30,000 admissions in 2023 to our ED. 30,000 admissions. We'd over of those 6,000 paediatrics. There is no space for triage when it comes to peds in Portiuncula Hospital. Minister, we need this faster. We need an acceleration, and I need your support on this as well, Minister. Thank you.
Thank you, Senator Dolan. Minister.
Thank you very much, Senator, and I fully agree with you. I mean, we have a growing population in every area of the country, and it's important that we respond accordingly. Portunclo University Hospital, serving the people of Galway, Roscommon and the West Midlands, has a reputation for the delivery of high quality, innovative and safe care to patients. This government is committed to the ongoing development of Portunclo University Hospital, and the hospital is in the midst of a programme of investment designed to improve services for patients. The new Orchard and Garbaley ward blocks are a 35 million investment comprising single suite rooms that will improve patient experience and infection control. These have replaced old wards, which will now be replaced by expanding the emergency department at an additional investment of 6.9 million. The capital investment discussed today is part of a much wider programme of investment and service expansion in Portunclo University Hospital. Funding has been allocated for the design and upgrade to relocate the hospital's sterile supplies department, which covers both Portunclo and Roscommon University Hospitals. In the area of cancer control, the oncology service is commencing extended day services and is providing additional treatment bays along with a third visiting consultant oncologist. I'm also delighted to note that the National Women's and Infants Programme has agreed to fund a new ambulatory gynaecology unit here in Portunclo. This service will create theatre capacity for patients requiring general anaesthetic, allowing the hospital to increase activity across specialties. I once again to thank you, Senator, for the work that you've done. And I suppose in relation to this whole issue, in relation to hospitals, it is complex. We need the funding. The funding is being provided, and it certainly has been provided here in Portunclo. And as you had identified, there is that growing population, there's increasing demands, and therefore we must respond accordingly. Thank you very much, Nita.
Thank you very